living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
6 in 10 American adults live with a chronic condition. That means more than half of the adults in this country lives with a condition that impacts their lives every day, and many of them live with more than one. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we're going to talk about the most common chronic conditions in America. Stay with us, we'll be right back. Welcome back to Healthy Living for Life. We're joined this morning by Dr. Doug Kunstweiler, who is becoming quite a regular on the show. So thanks so much for being here this morning, Dr. Kunstweiler.
Glad to be here.
So let's talk about chronic conditions, and let's start by defining what that means as far as how long someone has to have a condition before it's defined as chronic.
Well, there are different ways to look at it. One is by time, and generally people agree that if a condition lasts more than 3 months, then it is by definition chronic. For instance, if you have an injury to a joint and you have pain, generally you'd expect that to clear up in 6 to 8 weeks. If after 3 months you still have pain, then that's considered to be a chronic pain or a chronic condition. On the other hand, there are certain diseases that we know we have no cure for, and if you're diagnosed with them, then by definition they're chronic. For instance, we don't have a cure for high blood pressure. We have many good medications that can help control it, but we don't have a definitive cure. And so if you're diagnosed with high blood pressure, then you have a chronic condition that you're going to have to manage the rest of your life. So it depends a little bit on how you look at it.
Okay. So I mentioned before the break, 6 in 10 adults in America have a chronic condition, and 4 in every 10 adults actually live with at least 2. That is a significant percentage of our population. Can you talk about how that impacts our healthcare system?
Well, financially, it's a huge burden. Something like 90% of healthcare dollars are spent on chronic conditions. And when you look at a country the size of America, that turns out to be many trillions of dollars that are spent on that. Then you have to look at things like lost productivity and just generally people not enjoying their life. So it's a huge burden.
How about the cost to the individual? Is it pretty expensive to live with a chronic condition?
Yes, the biggest cause of bankruptcy in America right now is a medical bill. That's usually something more catastrophic like a hospitalization, but a huge amount of people's income goes towards taking care of chronic medical conditions. And I have read that if you have a single chronic condition, then on average you spend about $2,000 to $3,000 more per year on things like medication, physician visits, treatments than a person who does not have a chronic condition.
Wow.
So it's quite a large burden.
So there are lots of different types of chronic conditions, but just generally speaking, are there risk factors that typically are there for people to develop a chronic condition?
Definitely, and a lot of them are the same no matter what the chronic condition. For instance, diminished physical activity is associated with lots of chronic illnesses like heart disease and diabetes and high blood pressure. Smoking is associated with just about every bad thing you can imagine. Lung cancer, but also heart disease, stroke, high blood pressure. Poor diet can be associated with obesity. That's associated oftentimes with degenerative joint disease, as well as diabetes, heart trouble, lung trouble. So it just goes on and on. Yeah, there are a lot of common risk factors.
Is one gender more impacted by chronic conditions than the other, or is it kind of equal?
For the most part, it's fairly equal, but there are certain conditions. For instance, heart disease. Women in their younger years are generally protected from heart disease. However, once they go through menopause, then their risk rises pretty rapidly until it equals So it depends a little bit on which condition you're talking about, but in general, women are just as prone as men.
Okay. And we talked a little bit about the cost to an individual living with a chronic condition. What are some of the other factors that really impact a person's life?
Well, it often is associated with anxiety about, what's going to happen with this condition, how am I going to pay for taking care of it, and that's associated with depression. It affects sleep. It can affect family relations because of the financial impact and also just the stress of having that condition. So it really takes a toll in a lot of areas.
We talked about a lot of people living with 2 or more chronic conditions. What kind of complications or issues start to emerge when people have multiple chronic conditions?
Well, a lot can go wrong. Sometimes the medications for one condition interfere with the medications for another. For instance, if you have high blood pressure, there are medications we use to control that. If you also have chronic kidney disease, some of those medications make that worse. And so it can become something of a balancing act, trying to come up with a medical regimen that doesn't interfere, with all of your chronic. The more chronic conditions you have, the harder it is to treat.
Can you talk about what comorbidity means and how is that related to a chronic condition?
So comorbidity is a medical term, and it basically means that you have more than one chronic condition. For instance, let's say you fall and you break your hip and you're going to have to go to surgery and get it repaired. The surgeon will want to know, do you have other comorbidities? And so that might be diabetes, or it might be high blood pressure, other things that you're being treated for that can impact the acute condition that you have. So comorbidity means another chronic illness.
Okay, and we're almost out of time, but just really quickly, why do you think so many Americans are affected by chronic conditions?
I think in large part it's our lifestyle. We are a nation of drivers, not walkers. We're physically inactive. We benefit from cheap food to our detriment. Obesity is a big problem in America. That physical inactivity and lifestyle, basically.
Okay. All right, thanks. We do need to pause for a break, but coming up next, we're going to dive into what the most common chronic conditions are in America. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. This morning, we're talking to Dr. Doug Kunzweiler about common chronic conditions in America, and thanks for sticking around with us, Dr. Kunzweiler.
My pleasure.
So I think most people probably know, and we've certainly talked about it on Healthy Living for Life before, but the most common chronic condition in America is actually responsible for the most deaths in the country as well, is heart disease. That's a very broad term. What all does heart disease encompass?
Yeah, it is a general term. There are a number of things that can go wrong with the heart. Probably the most common one is a plugging of one of the coronary arteries that feeds blood to the heart muscle itself. And that's what leads to what is commonly known as a heart attack. When that happens, part of the heart muscle dies. As you lose some of that muscle, then the heart loses its strength and its efficiency, and it begins to not be able to pump adequately to meet the body's needs. And that leads to what we call congestive heart failure. Congestive heart failure is also a very, very common problem. You can have problems with the heart's rhythm. Normally the heart should beat in a nice, steady, regular rhythm, but things can go wrong with the mechanism that controls that. And a very common one is an irregular rhythm known as atrial fibrillation. There are a number of different causes of it. It can be from coronary artery disease, but it can also be from lung disease and from alcoholism, and sometimes it just arises on its own. We don't know why, but the heart's rhythm is not. You can have a heart that beats too slowly. You can have a heart that beats too rapidly. There are other things that can go wrong that lead to chronic heart disease. You can be born with a valve in the heart that isn't normal, that maybe is leaky, and that reduces the heart's efficiency, and that can also then lead to the congestive heart failure scenario. So there are a number of conditions that can lead to chronic heart disease.
Can you talk about what role family history plays in a person's risk for heart disease?
It can play a number of roles, such things as a defective heart valve. That tendency can be inherited, but also things like high cholesterol can run in families. Elevated cholesterol, high cholesterol, can lead to plugged coronary arteries and heart attacks and heart disease that way. High blood pressure can run in families as an inherited trait. And high blood pressure puts a higher workload on the heart that can lead to heart attacks, and that can also lead to congestive heart failure. So you can inherit a tendency from a number of different ways.
So family history or not, can heart disease be prevented?
To a large extent, lifestyle can certainly help to prevent heart disease. If you are more physically active, if you eat a healthier diet, if you stay away from alcohol and nicotine, then yeah, you can prevent to a great extent heart disease, even if you have a family history of it.
Once someone is diagnosed, can that diagnosis ever be reversed?
Reversed is a pretty tall order. There are some medications that show some evidence of reducing plaque in coronary arteries. Some of the cholesterol medicines can partially reverse at least what's going on. So I don't know if you could say that you can actually reverse it. Certainly you can manage it, control it, and live a lot longer life, by following guidelines, medications.
And what is one thing that each of us could do to either help prevent heart disease or to better manage it if we are already having heart issues?
I think the primary thing is to stay active, and what I tell people is I recommend walking almost every day of the week, 20 to 30 minutes. Most people enjoy that. They can do that. If you make that a habit, you're going to do your heart a big favor.
Okay, great. So let's switch topics now. The second most common chronic disease in the U.S. is cancer. Over 1 million Americans are diagnosed with cancer every year. How many forms of cancer are there?
A lot. Every organ in the body, from the skin all the way down to the bone marrow and every organ in between, can develop a type of cancer. When you look at classifications, there's over 200 different forms of cancer that have been recognized. But pretty much every organ in the body is susceptible to cancer.
Even though there are so many different types, are there common symptoms or warning signs people can watch out for?
It depends on what specific type of cancer you're talking about. For instance, skin cancer is a common cancer. And for skin cancer, the warning signs are sores that persist, that don't heal in like a usual sore would, or a mole that changes size or changes color. That can be a warning sign. If you're talking about cancer of the intestine or colon, then perhaps blood in the stool or a change in bowel habits can be a warning sign. Blood in the urine can be a warning sign for cancer of the bladder or cancer of the kidney. So each organ can have a warning sign.
We're just about out of time here, but can cancer be prevented?
I'm sorry, I didn't.
Can cancer be prevented?
Certainly, cancers can be prevented. For instance, skin cancer can be largely prevented by being sun aware, wearing sunscreen, minimizing your sun exposure, stopping smoking can be a way to prevent cancer of the lung and other organs as well. So, yeah, there are specific ways that you can prevent cancers.
Okay, we do need to pause here for a quick break. So thanks for that information, but coming up next, we're just going to continue talking about the most common chronic conditions in America and any preventive steps we can take and other information about those conditions. Stay with us, we'll be right back after these messages. Welcome back. Dr. Doug Kunzweiler is still with us, and we're talking about common chronic conditions in America, so thanks for sticking around. We're just going to keep on with this countdown that we're doing here this morning. The third most common chronic illness in the U.S. is chronic lung disease. And so like heart disease, my understanding is there are different lung diseases as well. Can you speak to some of those?
Yeah, chronic obstructive lung disease, or COPD, it's often called, is the one people are most familiar with, and that's emphysema and chronic bronchitis. But asthma is a chronic lung disease that people live with most of their lives, and that's quite prevalent. And there are some others that aren't quite as common, things like cystic fibrosis, which is a problem with the mucus glands in the lung that make a thick mucus. There are some autoimmune diseases where you get fibrosis and scarring in the lung. There's a condition known as sarcoid, which is a kind of an odd disease. We don't really know exactly what causes it, but people get scarring in their lungs from that. So there are a variety of other chronic lung diseases.
So it sounds like we don't always know the cause, but are there some causes when it comes to chronic lung disease?
Oh, definitely. Smoking, and smoking. Those are the top three causes. Exposure to chemicals, exposure to asbestos, that's a risk factor. Alcohol is a risk factor actually for developing cancer of the lung, along with smoking, which everybody knows about. Radon, which is an invisible gas that can be found in some houses, has been associated with lung cancer, which is a form of chronic lung disease. So there are several causes, but far and away smoking is the most prevalent.
Okay. When we talk about heart disease and cancer, I know for prevention, oftentimes we talk about getting your checkups, getting screenings. Is there a screening that you can do for lung disease?
There is. There's something called pulmonary function testing, which is conducted by a respiratory therapist. It has to be ordered by your primary caregiver. But that is a screen for COPD and also a screen for asthma. And it basically is you blowing into a tube, and it measures your lung volumes. So that's a screen for that. Another screen is a low-dose CT scan, which is a screen for lung cancer. The definition of a screening test is one that is done before you have symptoms. So if you have a risk factor, let's say you've been a heavy smoker for a period of time and you're worried about lung cancer, a low-dose CT scan is the screening test that would help to detect that. If you have trouble breathing and maybe there's a family history of asthma and you're worried that you might have asthma, then a pulmonary function test would be the screening test for that.
Okay. I think I can probably guess how you're going to answer this next question, but what is one thing we can do to help prevent lung disease?
Stay away from smoke. Don't smoke yourself, and stay away from people who do.
Okay, perfect. So we're going to move on to another top chronic condition in America, which is Alzheimer's disease. So when we talk about preventing chronic conditions, we talk about not smoking, healthy lifestyle with exercise and the way we eat. Do those kind of preventative steps also apply to Alzheimer's disease?
Well, we aren't really certain at this point what causes Alzheimer's. So there probably is a genetic component. There may be some environmental component as well that triggers it. That hasn't really been worked out very well yet. We know of some things that are probably helpful in preventing Alzheimer's, and those are staying active, physical activity, staying connected, socially connected. We know that people who are socially isolated have a lot more trouble with dementia. If they do get dementia, it progresses more rapidly. So there are some things that we know of that are helpful, but an actual cause and preventative, we don't really have a good handle on that yet.
What actually happens to a person's brain who develops Alzheimer's? It's a physical condition, correct?
It is. And there are some abnormal proteins that develop in the brain, and they seem to interfere with the brain's normal activity. Excuse me. And the way this gets expressed is as difficulty with thought, difficulty with reasoning, difficulty with problem solving. People have trouble with language, and this isn't just forgetting names. They have trouble with syntax and with grammar. They just have difficulty expressing themselves. And sometimes it can manifest as personality changes. People who are normally very happy-go-lucky and sweet personalities can sometimes become mean-spirited and even physically aggressive. So it changes the structure of the brain physically, and that leads to changes in behavior that we see.
Like other chronic conditions, are there benefits to catching Alzheimer's early?
There are. We do not have any really good treatments for Alzheimer's. But if you catch it early, then you know what to expect. You can begin planning, for what's going to happen, and you can help do things that will make the disease either less severe, or you can prolong your quality of life as long as possible, and that is by staying socially active. We know that there are things that require you to use your brain a lot, like doing crossword puzzles and playing music and all sorts of things that activate the brain, that do seem to soften the symptoms of dementia and delay the severe aspects of it. So yeah, early detection allows you to plan for it and begin to do what you can to help stave it off.
Okay, great. In our final seconds, Dr. Kunzweiler, final words of advice for people when it comes to chronic conditions.
Well, if you're worried that you might have a chronic condition, then you should see a care provider. Sitting around and worrying about it's only going to make it worse. Go see your provider, find out what's really going on, and follow their advice. And I would say stay active. If you stay more physically active, almost all of the chronic illnesses respond to activity. So stay active, eat a healthy diet, do not smoke, moderation in everything else.
Perfect. Thank you very much. And that's our time for today. Thank you so much for joining us. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.